Dr. Darien is with us, and today we are looking at tummy ache, appendicitis. How do you know the difference?
So how do you figure out the difference, especially when you have a crying child, maybe they have a fever, and you all of a sudden forgot everything you know about abdominal pain or stomach pain? This is when I teach parents how to just do a simple abdominal or stomach exam. So when you're trying to figure out the difference between a stomach ache, maybe from something that they ate, versus an infection that might need surgical treatment, my thing is talking to the child about their symptoms. If you can't, well, I would suggest doing a quick abdominal exam, and that includes just separating our abdomen or our stomach into 4 different quadrants. And while they're distracted, I often, for example, will play something on the television, or I'll ask a parent to play something on their phone. And that's really important because children, while they're distracted, give the most honest exams. And then that is when you just search around their abdomen or their belly, pressing finely. You want to be mindful if you have pain in the right lower quadrant, that is what we get concerned about, something called appendicitis. That's an inflammation of the bowel that might require surgery. So I focus in that right lower quadrant area when I'm talking to the child, distracting them, and if they all of a sudden stop what they're doing and they're like, hey, that hurts, that's when I define that as a red flag.
What about adults? Does it apply the same way?
The same way. Thankfully, you don't have to distract adults in this. Well, I would say in some of my patients, I do have to distract them when I'm trying to give them exams. But thankfully, you can talk to an adult mostly. Appendicitis often happens between 10 and 30 in those age groups, and so that's when you want to pay the most attention, but it can happen to anyone. I've diagnosed it in variable ages.
And are you just checking for pain, or is there like a lump or something?
You know, there's nothing you should feel. Pain is the biggest thing, but also, for example, we look for signs of peritonitis. That is inflammation of the whole bowel. That comes with pain with jumping around. Even the car ride to the emergency room, sometimes parents will say every time we hit a bump, they were screaming. That's a sign you should look for.
All right.